Hey, hey.
Hey, what's going on?
Happy casual Friday Eve.
Yes, the weekend is almost here. I'm excited.
It is, and it's funny because it has come upon us so quickly, right? I
Yes,
feel like,
especially when you're so busy. Honestly, I think because with Monday being Labor Day, celebrating the Labor Day holiday, my days are kind of mixed up. Today, I'm thinking it's actually Wednesday, but it's Thursday. So, hey, I'm excited. The week is almost up.
yes, yes. I just realized something um, that we didn't decide what emoji we were going to do today. How about this, you guys? Welcome to Medical Billers Network Live. Let's just tell us how you're feeling, where you're coming in from. Where are you tuning in from to this radio show? Okay. This live
That's
radio
right.
show. Let us know. Let us know. Where am I? Hey, Ashley. Good evening. Good evening. I am tuning in from the beautiful Charlotte, North Carolina. It is quite lovely out today, except I've got my lovely windy locks joining us because it was very windy outside today.
It looks good, Jasmine. Honestly, it
Thank
looks good.
you. Thank you, Mother Nature, for your assistance in styling my hair. Yes,
Oh
I like yours,
man.
Renee. You've done a great job with your hair today.
Well, actually, I kind of cut it down a little bit, and I've been thinking because my hair been kind of growing out, and so I said, you know what, I feel kind of wavy, so I think I'm gonna try to bring the waves back.
Ooh, bringing it back, taking it back to the ways. Remember them days when my brother had that good gel. My brother had that.
Man.
Hey, hey, Christy, Patrick, welcome, Connecticut. I like it. So, Kansas City, Missouri, right? That's K and KCM.
Mhm.
I think that's what we said. Right, right. Ashley, correct
Yep.
me if I'm wrong. I was just telling my girlfriend that she was doing homework tonight too with her kids. I was like, I'm very excited that my daughter is now a junior in high school, so she very minimally needs my assistance. But then our son is only in second grade, so his stuff I can do with it
Mm.
like in a flash. I'm just gonna hope that my husband, from like middle school, end of elementary, middle school age, when they start getting into that stuff that I'm not really into and they really can't work independently. Hope my
Right.
husband's ready because I will be punting that for sure. We'll be punting. So,
Oh man.
okay, hold up. So today, you guys, when you jump in your live stream, if you don't know what we're chatting about today, we are talking about software and software needs. So Renee has joined us again. Yay,
Hmm.
Renee. And yes, and we get to do a little bit of like looking under the hood at a couple of different tools that we use.
Yeah.
So kindergartner sight words. I love it. Yeah, you know what? The sight words, listen, I can ace it. All of the kindergarten stuff. We did first grade homeschool. We actually did our own homeschool thing with a different program online last year because it like the virtual thing was not for me with our
Right.
public school. The Zoom for my son was not a thing. And so we got to like do all the fun stuff. So, words on the board and like, creating all of the little fun activities at home. Girl, I could do it
Hmm.
all day, every day, Ashley. Let's just keep them at that age. I can homeschool 100% of the time.
Awesome. Awesome.
Christy, so good to see you. I know you're West Virginia, yes. So let's see. Okay, guys. So today we are looking at software. We're going to go through two different solutions. One that is just a billing software, and then one that is an all-in-one EHR solution. And our goal today is to really talk about the things that we believe medical billing software absolutely must have, and that is from the perspective of a revenue cycle oversight over managers. Gracious, I'm from medical revenue cycle management and folks that are involved in the revenue cycle oversight. So people that actually want to make sure that the revenue cycle is done 100% through and through, no issues with the software creating those problems and all that friction, right? So with that in mind, if you guys think of something that I know a lot of you are already in the billing world, what are the
Yeah.
tools that you love in your software that are already built in or integrated into the software? Feel free to plop them in as we start to kind of move through the topics today. And I don't want to skip over any questions. So if something comes up, say high level, about kind of what we want to see in a software, totally pop them in. I don't want to get too far in the weeds of the softwares specifically, so we're not going to talk like deeply into features. We're going to stay fairly high level and really just talk about the things that we believe these systems need to have so that we feel, comfortable in the area of billing. We know that we can manage and oversee the work that our teams are performing in the most adequate ways possible. Hey, tribe, Callie,
Yeah.
still the early afternoon for you guys out there. Hope you're having the day nice. Yes, born in 1992, things have changed. Yeah, definitely changed, Ashley. Education on computers 24/7. I can't do it. It's not for me. It's not for me.
Me neither.
I mean, the best that I figured out is I do like audiobooks only for the convenience of driving, but I cannot do a textbook on a computer for the life of me. I have tried. I cannot do it.
Those are good bedtime stories for me. It'll put me right to bed.
Exactly. It feels like that. I mean, I don't know what it is about me and like paper, but I need to have a book that I can like with a pen and a piece of paper,
Uh-huh.
draw lines, write little notes, highlight all this. I guess I say my age, right? Because these kids, I mean, I don't know if any of them, like my son's age, I don't think he's ever going to have to do that.
It's to me, I think there's still value in that. To me, I think in my mind, it helps me to still remember things better versus just texting or typing it in. So, but it's me. Maybe it's an old school thing.
I was gonna say we have to fast forward another decade or two and then interview the older versions of our children, and if they're all jacked up, then we'll know. Like, oh no, our way was better. We we know for sure. So I love it, Rene. So all right, let's dive in. Does anybody have anything coming to mind right now? Okay, here we go. Yes, coding books more than software all the time. Yes. You know what's so funny? I am doing another prep to be able to take a different certification, and someone sent me like, oh, here's the ebook and whatever, and I was like, all right, I'll try it. I can't. It's almost like what you were saying with the falling asleep and stuff. I'm like, at the moment that I look at it, I'm like, oh no.
Yeah, I agree.
You use papyrus. That's good, Patrick.
That's funny.
Etching into papyrus. I remember that was like an exciting thing as kids when we got to like explore and create like our own versions of papyrus in school. I don't think the kids would appreciate that these days. What are we supposed to do with this? All right.
Oh man.
I'm going to get my screen share up and rolling. So the software I am going to share first is where is my share button?
One thing I do want to say, Jasmine, while you're working on that, I remember when I was just starting, my company, and the first couple of clients that I had, basically I was just, they were the one that was paying for the clearinghouse and through the practice management systems of the EMR systems. That is where, I would go in, do the billing. But then as I started picking up clients, I started realizing, okay, I'm having to log into like 4, 5, maybe 6 different EMRs. And it's not, I guess, efficient, you know what I mean? Because I'm having to log into different systems and learn them. And that became a pain. And so I think as a company, I mean, maybe if you want to stay relatively small and maybe have 2 or 3, that might work. But if you're definitely looking to grow, then getting a billing platform, I think is the way to go. And I know some people kind of worry about, well, what if I lose a client? Then I have all this data. Well, all that can be exported and imported. So that's perfectly fine. But definitely, I think with the billing platforms, you can use that one system and of course track everything right then and there. And of course, I think depending on the type of platform you have, I'm sure they'll have different bells and whistles, things that may, make things a lot more appealing or a lot more efficient for you. But I think at the end of the day, as a billing company, just using one platform to track everything, it really helps to manage things better and just be that much more efficient.
I agree 100%. And it is a tricky thing when you're using other people's systems for
Yeah.
exactly that reason is creating process, right? It's like inefficiencies.
Hmm.
And unless you're really great at process establishment, which if it's, just you and a couple of folks, it can be a little challenging to try to, create kind of adequate processes for multiple
Hmm.
people. You're going to have a little bit of a struggle with different
Yeah.
software. And I speak also from personal experience. There's definitely challenges that arise when you have a lot of different software environments, including limitations, like things that you might find challenging to stand by your services and the service delivery if you are limited by the features of the system that the client
Right.
has. And so we're very big on not saying yes to all software, especially if someone's coming to us with a brand new system that we are not confident in. And don't be afraid to say, sorry, can't do it,
Yes.
because you're the one at the end of the day who has to represent your work, right? And so you'll want
Correct.
to make sure that you can represent it well by standing by the delivery of service and the way that your software can be efficient or not. And we've learned the hard way to say no because of the fact that initially we're like, sure, we'll figure it out. Or somebody kind of sold us on it and said, oh yeah, like we've been doing billing and we got the whole thing worked out and all we can show you how this works or that works. And, so we'll get into the system and then realize that instead of it taking 20 minutes
Hmm.
for one function, it now takes 2 hours. So you have all of these ridiculous inefficiencies that you're paying for now. They were
Yep.
paying for it before. And now you
Exactly.
assumed the cost in your people's time and then now your bandwidth is limited. So yeah,
Definitely.
very good points, Renee. I love it.
Perfect.
So I finally got the right screen pulled up. So I think, do you see the right screen? Yes.
Yeah. Yeah. I
Okay.
see the screen.
Okay, good. All right. So this system is a fairly basic software. This is a training module. So some of the data, as you'll notice, when I click around and stuff, is outdated as far as like the time frames and things. So when I go to the aging report, it'll look like a really bad aging report. So, so don't worry. This is not a live client. I'm not taking you into anyone's data. So just so that you know, so that one of the things that we really like about this particular solution, it is built for billing companies. So like what one of the things that's helpful for us is that it has the ability to, did it just put the screen in the way? What just happened? Oh,
Yeah. There you go.
okay. I was like, something moved on my side. All right. So it has the ability um, to connect with EHR systems, right? So it has the ability to, through an HL7 connection or other types of integrations, pull the data from an EHR system or EMR system, as we talked about last week, so that you have the information and the encounter information that you need, the patient's information, so on, right? So there is the flexibility there. So you're not, with a complete separation of an EHR, EMR. The one little caveat to that is that the EHR system has to play nice, we'll say,
Yes.
because there's a lot of solutions out there that are all in one that do
Yeah.
not play nice with solutions like this that are independent of their software. So you would have to keep that in mind, whether it's this solution or another one. I just want to show this as a great kind of insight into the little features and stuff that we like. But
Sure.
this is not this software, just like any other. They all don't walk on water. There are little things. One of the parts of this one that I don't love is that we don't have any sort of visual dashboard views on here to kind of show performance and things on the main screen. However, one of the things that I like about this main screen is that it gives you a customizable dashboard. So if there's certain things that I want to see here, so for example, I've pinned the claims clearinghouse status onto this main screen. So if I wanted to do the same thing for, let's say, the payments screen, I could pin that to my dashboard and it'll show me the payments or even what's showing up in the way of loaded ERAs, which means that ERAs that are ready to post, I could have that there as well. So this is like the escrow screen. So you can pin and unpin whatever you want to see or don't want to see on the screen, which is helpful. And it is a user level pinning process. So it's not something that impacts all of the users. You can customize the view in whatever way you see fit. So I could also remove favorite reports. I can remove the clearinghouse statuses and things like that. So that for me is probably one of the most important things as a billing software, to have a dashboard that gives you a quick snapshot view of what's going on. Personally, things that I want to see in a snapshot are claims, really all of the high level. So claims, what the status of the payment posting process is, ideally a quick snapshot of an aging, if just the aging buckets is fine. Excuse me. And perhaps some confirmation of the deposits. So this one has the payment posting or the ERA processing, but maybe some financials, right? So
Right.
overall, so patient and insurance. So you have anything you want to add to like a dashboard, or what your thoughts are on something like this, Rene?
Yeah, for sure. Yeah. So it's like for me, so the platform I use is called Ability. And as you were talking, Jasmine, with the dashboard, Ability provides that, right? So like for each of my clients, I basically create child accounts for each of them. And when I click on those child accounts, it basically take me to a dashboard. And in that dashboard, it's going to show me pretty much who is the highest paying insurance plan, whether it's Aetna, Blue Cross Blue Shield, United Healthcare, Cigna, and so forth. And then from there, it'll show me the aging, like the average aging, I guess the average aging days for each payer, whether it's 12 days, 15 days, correct, right? And then from there, it'll kind of say, this is the average reimbursement amount per each payer. And then from there, it goes into, like your denials, is it because of coding or demographics or whatever the issue is, to kind of create those buckets of denials. So that way you can see what are your common issues. And so the nice thing about it, you can generate reports from that and be able to provide it to the provider and say, hey, listen, so far last month, this was the highest denial. And so this is what I'm seeing, maybe because the front desk person are not verifying, or they're not, putting accurate data or information about the patient. So therefore, when we're trying to process claims, maybe the subscriber name is wrong, or the date of birth is wrong, whatever it might be. But it really gives a detailed level of information based on what you want to see. And I think the dashboard is really good, right? Because it gives you that snapshot that you want to see. So that way you kind of have a nice pulse on things, right? And of course, if something that's not trending right, then of course at that point you want to look further detail into it. Because I would imagine, as a billing company, you want to kind of set up your KPIs or key performing indicators or your goals for each client, so that way you're making sure you're tracking in the right direction. So I think definitely having a dashboard, to me, I think it's nice to have, for sure. I'll say that.
Very valuable. Yes. And I love how you mentioned about the child sites versus the parent site. This software is very similar in the way that you can switch between the different practices. So like if I wanted to click out, I could swap out and move to a different client server. We do not, and I recommend that you do not, if you're listening to this, that you do not use one software for all of your clients, because it will cause problems with the data exporting, and you probably will have your hands tied when the client is trying to exit. You always have to start a relationship with the end in mind. I know it sounds like, oh no, they'll stay forever, but they may not stay forever. So you need to be prepared to hand over the data without much pain in the process. And this is any sort of setup like this, whether it's the software or like Rene's, most of them can kind of remove the child site and give it to the provider if they want to take it them away themselves, or
Right.
take all the data out and give it to the provider. So it's absolutely imperative that you make sure you're picking a solution that is not going to use all of the data centralized to like one main server and all your clients are there. I don't care what the software company tries to tell you. Don't do it, because a lot of them
Exactly.
try to sell you on that. They're like, oh, well, we just can switch it out and you just will be able to select your practice and this and that. It's not a good thing to intermingle the data. So anything you want to add to that, Renee?
No, honestly, you hit the nail on the head, and I couldn't have said it any better than what you said. Honestly, you definitely have your child account. Keep your clients separate, so that way it doesn't cause any confusion. If and when your client decides to leave, hopefully not. But another thing I want to add to this too, right? Because I've had this conversation with multiple clients of mine. Um, you know, initially they would say, well, I was considering maybe just using my EMR to kind of keep things, I guess, on the same platform versus, everything going to your billing system. So what I tell them is this, like, for example, whenever I run reports for them and I'm telling them, hey, this is like your average AR days or whatever it is, all that data is based on when I export it from your system and put it into my system, and I'm
Mhm.
tracking everything because sometimes things can be misleading. And so that's probably one of the most things I'm always clarifying and letting my clients know. So that way this is based on when we submitted the claim, basically when everything has been worked and done in our system, this is what our data is basically pulling from. But also too, it's you know because you also mentioned one thing about the systems that every billing platform may not necessarily integrate fully with the EMR platform. So I know with mine, unfortunately, I have to export it and upload it, whereas it would have been nice to where from a click of a button, it would just freely flow into the system. But
Mhm.
either way, we make it work, right?
Yeah.
But it's just things of that nature that
Yeah.
you want to consider.
And since you're talking about that, Renee, so this system does have that ability, and one of the things that I like about it too, you can schedule those calls, like you were saying, the calls out to the software company to
Yeah.
pull request the data. But it does depend. If it's an HL7, it has the ability to have mapping that automatically connects, and it will pull that information as long as the API and everything is set up properly.
Sure.
And it will tell you, an alert will pop up on the dashboard if there was some sort of issue. So it does make it a little easier when there is an external EHR solution that you're connected to. But for sure, those of you who are looking for a solution, having one that you create, if you have to do the download uploading, you want to create a very consistent schedule for yourself or your team, and a reconciling process. So I'm all about a reconciling process. So meaning if you are uploading 6 days a week or whatever the schedule is, 5 days, then you want to make sure that you are on a weekly basis checking to ensure no one skipped a day of downloading, uploading, especially if
Hmm.
you outsourced that or delegated that to a team member. So yes, make sure that you've got some sort of check and balance to ensure you don't skip a day, because that's where the that's where the heartache really starts, and you realize you're missing
Yes.
whole
And let
day.
me tell you, oh my goodness, like people, if you're listening, what Jasmine just said is so true. I can't stress that enough. Like, what I do, so every day, uh, I run AR reports. And you may not necessarily have to do it every day, but I do it because you could potentially miss something. And I can't tell you, like, for example, today I was on the phone with Blue Cross Blue Shield maybe for about an hour and a half, just going through the AR reports. Because what I realized is that in the EMR system, it'll say a claim was generated, and
Mhm.
then I look on my billing platform, and it'll say a claim was generated. I mean, of course, was created and submitted, but sometimes for whatever reason, those claims get hung up somewhere in EDI or what have you. And then if nobody is following up on those claims just to get a status on it, you could probably go 2-3 weeks, even a month down the road, and you're just realizing, oh, insurance don't even have this claim. And now you're panicking like, oh my gosh,
Yes.
So
Especially if it's a system or a payer that has a really short, timely filing limit. I mean, I know there are some states that there are carriers that have 30 days
that's
of a
crazy.
timely filing, which is like, wow.
Yeah.
I mean,
Yeah.
thankfully, like, our federal payers and a lot of the blues are still a year, but, these guys will sharpen up on us, and we don't have these processes down or some sort of quality assurance or an audit process to say, okay, like even something simple as tracking a number. So like if your EHR system generated 100 encounters for this week, then you want to make sure you have 100 claims showing up in your billing system, right? So there's just a basic checks and balance that you can try to enact. It doesn't have to be a big project of a QA process, but there needs to be something there. Like what is going to be your QA if you have a separate EHR tool from the billing tool? So yeah, these are super good points. I mean, those are things that I hope you guys take to heart, because there's so many people.
Oh my gosh. Oh, so here's something else, Jasmine, and I'm curious to see what your thought is on this, right?
Yeah.
So I know there's been maybe a client or two, who came to me, hey, we need billing. Okay, great. And then of course they'll transition to my billing platform, but then they'll say, oh, by the way, I do have some outstanding claims. Can you like work on that? Like for me, I'm in the part I'm sorry. Whoever was working on that, they got to work on those, because that's going to be too much for me to try to figure out where those claims are at, and then for me to start focusing on claims moving forward. So
yeah,
I'm just curious. Do you take those type of clients on and do that for them, or do you just focus on when you start and then on forward?
yeah. So also, learning the hard way. This is why we have this platform, you guys, because we don't want you to learn the hard way. So truth, at first we used to say, okay, yeah, no big deal, because we thought, okay, yeah, we're great at this. And when there's a big AR, it makes for a great opportunity, right, to recover revenue and have a really nice spike in their commission at the front of the relationship. However, what we realized is that sometimes people have decades worth of AR that has been that's a little untamed, we're going to call it. So what we do is in the very first conversation, I explain to them that we treat our time frame, so the date of service, that the very first date of service that we submit, that time frame we call, right now it's the Inlera era. Before it was the IPS era. It's essentially, this is our time frame. We are responsible 100% for every single claim after this date of service. We can stand by it. Everything from before this date of service, we will take a look in usually the first 4 to 6 weeks of our relationship, and give a real consensus on what we think is possible. If it's possible, usually if it's like, let's say the practice is fairly new, only a couple of years old, someone actually did the job of following up, just maybe not so great as far as recovery efforts go. If we see that there's potential, we will just wrap that in right into our typical commission, and no big deal. We will make recommendations if we see things past timely for write-off. But if this practice, let's say a decade or two in business, and we see there's, half of the aging is in the over 120, they were to be like, hey, so here's what we can do for you. We can do a deep dive project, and I break down kind of what we think the estimated time for resolving that project, and it goes secondary to our work. Essentially, we say we will take this project and we'll assign a separate set of folks to work on it. And it might take, depending on, of course, the size of the project, we'll look at the number of claims and the amount of effort the team can put into those claims per day. And then we'll plan out the project, and it can sometimes be 6 months, 9 months. It could even be a year if it's like millions in aging. So, and that's mostly cleanup, which is really just if they're wanting to keep the same software, no big changes, what have you, and it's just a matter of us making it look cleaner. That's when we will take on that project, and we call that really a deep dive recovery project. And it takes a separate set of individuals that can be assigned to that work, because you're going to distract your team that is supposed to be focused on providing like optimal and great services. You're going to distract them trying to do discovery on stuff that you really have no control over. We don't really know did they ever send the claim? What was the clearinghouse that they used? We don't have visibility in a lot of ways to that clearinghouse. So, so I mean, totally think that if you choose to take on projects like that, be upfront and say, listen, 2 ways we can do it. Either you say, no, Doc, or no, never mind, Jasmine, I don't need it. Or you say, yeah, I'm open to it, but know that one is going to come with a fee potentially, and the other one might not, but it really depends on what we find. And be real and honest when you get to whatever time frame. If it takes you 6 weeks, 8 weeks to review it, then be honest when you present your findings and just say, look, it's a mess. I don't think it's worth it. I mean, we've been honest with that. Like, you've got a mess of AR. I would recommend either we skip all of it, not, meaning omit that data from our reporting, or we do a cleanup project and write off at, the majority of it that, is over 120, because it's going to be what I typically do. And I know that this probably question is going to come up. I typically charge per full-time employee, which is basically per FTE. So totally separate project. We charge them for those individuals to be assigned, dedicated to that cleanup. And it's a temporary thing. It's not like permanent, but at least there's no pain in the process for you. You can say, look, if we recover something, that's great for the practice. Otherwise, at least that you'll have a clean aging and we can see things more clearly moving forward. So, cool. All right.
Awesome.
So let's talk a little bit more about this software. So you guys, I'm missing some questions. I'm sorry. So Rene, do you use standards for import and export? That's a great question.
Standards, I guess maybe elaborate a little bit more on that. I guess
like when I said the HL7, or is there a certain data format? Like, is it CSV or is it? That's what we're talking about.
Yeah. So whenever I export it out of the EMR system, the format looks, it says TXT. I don't know. I don't know the name of the file per se, but it usually comes out in TXT format.
Yeah.
And then that's what I'm able to import into the billing platform.
So they've mapped that for you then, meaning like they've set it up according to
right.
Okay.
Exactly. And then of course, once payment comes in, the billing platform is, every day, I think maybe like every hour or so throughout the day, it's constantly checking with insurance companies. And as we get the ERAs, then I can export that into an 835 file. And that is what I use to import back into the EMR. So that way it'll automatically post the payments.
Oh, so you're sending you're sending updates back to the EHR for the provider side.
Correct.
Very interesting.
Yeah.
I've not heard of that before. That's interesting. Yeah.
Really?
Yeah. That's good.
Yeah.
So, I mean, I guess it's a good thing because you're able to continue updating them on the status of the claims directly in that primary EHR instead of having them go into your system.
Correct. Exactly. And so what it does for me is that then, because I'm like I said, when I run the AR reports, then that lets me know, okay, what I need to follow up on, especially if it's been, a couple of days that have passed and I haven't really seen anything come through as far as ERA for that particular claim. Then at that point I do follow up on, but usually once I follow up, the ERAs just start rolling in, and then I just import it back into the system. Payments get posted. the ARs continue to go down. And here's another thing too, right? With the ARs, it's not going to be zeros. As long as they continue to see patients every day, it is not going to be down at zero. Because I remember I had a physician. He was like, "Why my stuff is at 30 something thousand?" I'm like, "Well, for one, you're busy, and two, you see patients every day. So every day that you see patients, that it just adds to the AR report. But what you don't want to see is where you're lagging 3 months behind, right? You don't want to have that. So
yeah, and AR, and this is not going to be a pretty. So I'm gonna click into this because this is one of my favorite parts of the system. It's just not going to be super like useful at visibility for what Rene just explained. But right on the main screen, it can go to the interactive aging screen, and see, I told you this practice is in very bad shape, you guys. Everything is over 120. But what Rene was just talking about is if they were all brand new claims, the aging starts at 0. So this first bucket, as soon as the visit happens, usually software, when the encounter is created and claim goes out the doors when the clock starts. However, some of the software is not by billing date. So right now my aging is by billing date. Some of it's by date of service. And this doesn't look any different. But if the report automatically shows you by date of service, then it starts the moment that visit closes, the clock starts ticking. So you have what we call aging. It's just the first, the visit that just happens going to be in your first bucket, the 0 to 30 bucket. So yes, so that is a really good point there. And Patrick, that was a really good question too. And I saw you were saying the examples, HL7, EDI. So he gave a couple of examples there, and then totally like you surprised me with that importing back to the client's primary EHR. So that's really good. And Lee, oh my gosh, I have not seen you in ages. Hey. All right. So I'm seeing you said, do we not recommend you start? So here's the thing. At this point in the industry, there are so many billing systems right now, and so many web-based, cloud-based, affordable ones that if you were anticipating starting a business and you just want to kind of get out there and peruse, a lot of the systems even offer, if they don't offer a full trial, some of them offer free software. That's the first thing. And they don't charge you till you get claims out the door, right? That's the first thing. Second thing is that some of them will offer you a trial for whatever period. And if you just straight up tell them, look, I'm starting a company in the next 3 to 6 months or whatever, I would like to take a look at your software for the potential of me utilizing it for my billing clients. Just tell them, because there's so many solutions out there that they would be happy. And even if you don't, let's say, decide on one of those solutions, you already get a chance to kind of pick apart the ones that you know that you don't want, right? You can do some elimination. So I totally don't recommend that you wait, because then let's just say we're talking about all the stuff that we want our clients, that we want our software to do, right? You won't know that, and you'll be in the system learning what you don't want to, while you have clients, and that's not. So
that's never a good thing to do.
Exactly, you're learning along the way, and it's hard to build the plane while you're flying. So I mean, it's not impossible, y'all know it's not, but it is hard. So I just wanted to mark off real fast too the percentages, kind of like what I was just mentioning. Typically, if your aging is in a good state, your 0 to 30 is going to be about 60%, right? So obviously this is not in a good state. So it's on 121 and over is 100%. But you guys get the idea. Hopefully next time I pull this up, I'll have to play around and do some work in here in this demo site, because it's just not as useful right now in the state that it's in. But yeah, I hope you guys get the idea there. So NC Worker, oh my gosh, hello, good evening. It's great to see you again.
Now, right. Jasmine.
Yes, go ahead.
In this system, does it also show you any potential denial buckets or demographics or anything specific?
Yes. Yeah. So on the main
Okay,
screen here, what you have at the top is from the clearinghouse. So these are
gotcha.
claims that are rejecting back either from the clearinghouse or the payer, right? And so this is essentially data coming from the clearinghouse integration. And it is fully integrated with its own clearinghouse. But what you're talking about is for this software is called the denial work list, I believe, which is down here. So from the ERAs that come into the software, the ones
Hmm.
that get loaded, it automatically pulls out the denials. So anything that's non-CO 45, it pulls it out and pops it into this work list, which is one of my absolute necessities for software. And I say this absolutely
Yes.
we have software that we work off of that do not have this tool. What we do instead is we have our payment posting team basically create a work list for us in our help desk, but that's a whole other topic we'll talk about a different day. But I don't love that process because
Yeah, I
right
bet.
in here, yeah, I mean, and these are really old claims, right? But you get the general idea. So it's pulled all these patients' claims into this system. And if I click on this, I see the procedure code and I see even the reason for the denial just from this
Hmm.
view. And I can also like unbundle all of them. Right now they're in the summary view. If I wanted to, I could unbundle all of them and see the
Nice.
denials and a bunch of CO18s, duplicate claims. These are just fake claims that are out there in the software. But, you get the general idea that, if you wanted to be able to isolate by a specific code, you can do that as well. So if you're working on, let's say, a particular payer's issue that has arisen, and the insurance ID, and that denial that is coming in, let's say it's because of a missing modifier or diagnosis that's selected wrong, you can pull those out in this work list and start to work through them right away, or have your team working through them and viewing EOBs directly from this screen. So yeah, all of these little hyperlinks take you directly to the information. So you'll get to the remit from here, or the ERA, you get to the patient's account, directly to the encounter, which is that visit, right? So I love that there's a lot of accessibility instead of it just being a list that needs to go to
Right.
Excel, and then you got to go into the patient. You can see a lot of things very high level. And then from my perspective, the thing that I'm always looking for is the revenue cycle management, right? So how can somebody manage the people doing these types of tasks, right? So let's just say, there's 96 here. Let's say this is how many comes in on average every day. And I have 3 people on the team. I need to know on average, there's 100 claims that are coming in, or remits, or denials, that are coming in. I need to know what my team's target is every single day of the week. How many denials reasonably can they work through? And how can I monitor the fact that they've actually done that work, right? And
Hmm.
so you can only do that when you have visibility to it. So,
Correct.
so denial workflow is super important to me. So,
Let me ask you a question. So let's say with all these claims in here, let's say they're that it's been rejected by the clearinghouse um, because let's say Blue Cross Blue Shield requires the claims to include the taxonomy code. Can you click all those claims all at once and correct it one time?
so on that screen that we were looking at was specifically denials. And I think in denials, you have to go into each encounter to make those corrections. And if it was taxonomy related, from in here, there are some things that you can do by bulk, but still, I think a lot of that information is going to be corrected claim by claim. So
Mhm.
this area is the claims. What I clicked in was the payer rejections on that main screen. And so
Okay,
I've got a list of encounters that were rejected, see the claim status by the payers. And so
gotcha.
I have the reason codes on here that tell me, which in this case, it's hidden. Yeah. Oh, it actually it's not expanding the reason codes for us. So I guess you'd have to click into it. Yeah, usually the reason codes come right underneath.
Gotcha.
Oh, maybe I gotta. Nope.
All right.
It's not showing it, but it's a demo site, so it's probably glitchy. It usually shows right underneath the reason code for that encounter. So if I were to click into the encounter itself, yeah, it's glitchy on this side. It's not even going into the encounter, so
It's okay. I get it
happens
though.
sometimes in the demo sites. So let's see if it works on this one. Nope. Yeah.
Okay.
So it just doesn't have any, because it's not a live site, so it doesn't have any real connection. It's just a bunch of test data that they've copied to create for us as a billing company when you show the clients. Yeah.
No, perfectly fine. Yeah, and I asked that because again, it's all about efficiency, right? And I think for those that are out there, and again, if you're just starting off with your billing company, and when you're looking at billing platforms, you want to look at I guess the functionality of it. Is it something that is designed in a way to work very efficient, to where if a claim for a specific payer and there's a reoccurring issue, maybe you can fix all of them all in one time, or even create business rules, right? Because if every time this claim gets imported into the billing software, it's going to cause the same error every time, you create that business rule, so that way it'll automatically fix it for you once it's imported in. So that way, it's not an ongoing thing. And so I think anytime you can create business rules or, fix the claims in a very efficient way, it definitely saves time.
Absolutely. I agree 100% on the rules, especially when you're notorious payers for certain types of denials. You have to have a system that has the ability to kind of automate some of that for you. So this one, I did the clearinghouse rejections, not the payer one, and it popped open some rejection reasoning or whatever. Like here, this one's probably the most easily identifiable. So payer ID or member ID must be between 7 and 12 characters or whatever. So even in this instance, though, I think you'd still have to go into the encounter level to be able to correct it. So it is not something you could do in a bulk per se. So yeah.
Oh, that's good. That's good.
I gotta open my notes back up. There we go. Oh, so I'm gonna go back. Let's back all the way up, because we got into the dashboard and it like totally shifted us away from something very basic, which is the beauty and ease of some things like scheduling, right? So like patient registration and scheduling go hand in hand with eligibility, right? So being able to have somebody in advance schedule an appointment, ideally. Not every practice can do that. I know there's a lot of walk-ins in certain types of specialties, but if you are having your patients register in advance and you have the information, you absolutely need to have eligibility, ideally checking automatically. So if you have a patient that gets scheduled, and I don't know where there's any data on here, but there's typically some sort of indicators that might show up on your patient's visit. So I probably am getting too far in the weeds with this test patient, but we're gonna roll with it since I already started down this down this path. I just want you guys to see. Did I schedule him? Yeah, I put him on Bailey's.
Now, are you able to verify the patient's benefits through the claim itself?
Yes. Yep. And the system will automatically let you select a patient. Select a schedule. What we were just talking about earlier, like using these rules and scheduling features, it will automatically. Where am I? 9:09, right? 8:30. Where is my appointment going? If I did this right, select all. Yep. It will automatically let you have the patient's checked for your next day. So so you can get an indicator on the schedule. I was trying to pull one up so you can see. So like if you come in the morning, or if you are letting the software automatically check for you at night, it will show you with a little checkbox or an X on the patient that they are not eligible. And you also can get a work list for people for your eligibility report as well, of what that kind of batch what it bounced back. But then you also can do automatic checks. So let's say patient walks in and, oops, I gave you the wrong information. That's why I didn't go through. You can type it in and click one click inside of that patient's account to be able to request eligibility checking. So I'm going to go to just somebody's account to see. There we go. This one's a little, yeah. So down here, so if I were to click, it's not going to actually run anything, I don't think. Because it's not live, but it'll run that eligibility check right there. And then again, back to like the check box, if it was eligible, it'd be a little checkbox there. You'd have an effective date, expiration date, and it would help to ensure that your claims don't have issues with processing just from basic data, right? All of that basic data capture, which we know is still the number one denial for us in healthcare. So data capture can be remedied by trying to be connected to as many of your clearinghouses where possible, so you can let that data get automatically checked. And I was just checking to see if there was any fake eligibilities in there, but there is not.
Right.
So yeah, anything that you want to add? I don't want to go too far into the weeds on that.
I mean, again, I think to me, that's probably a must-have feature for me, where you can quickly run the patient eligibility from the claim before you submit it, because that will save you any double work, because sometimes you send that claim and they get denied and then you have to go right back into it. And so the whole point is to really set up a process around the functionality of your billing platform and maximize it and use it to the fullest of your capabilities. So that way you don't have to do double the work, right? And then of course your clients get paid a lot sooner than later too. So that makes a big difference for sure. So this is really good, Jasmine.
Yeah, and I would say that too, related to the data capture, is if you have your practices set up properly, you're already asking for patients' insurance cards. The best thing that you can do for your billing company is to put a copy of the card in the patient's account.
Yes.
Make sure there is a scanned copy available. Because if, let's say, you're not connected for some reason to a particular carrier, or you don't have the integration or the ability to do the real-time eligibility checking, then you're going to want to have the access for your billing company to do that check for you. Like Rene was just saying, whether it has to happen manually through a software like Availity or another solution, like you would absolutely want them to be able to reference the card, because sometimes it just happens that people pick the wrong information, and no matter how many times you train your staff on where that data is on the patient's insurance card, there's going to be that one card that comes up every few weeks or months that just pops up, and you have no idea where to find the team member thinks they found the right ID number, but it might be like a group number that happens to be the largest number and bolded on the front of the card, which still is mind-blowing to me how many insurance companies still do that. Like, no one, as billers, as people who manage a revenue cycle, no one really cares that much about the group number. It's really not that important to us. So
oh my God, that's funny.
So get copies of the card scanned in, and then same thing, that really goes hand in hand with referrals, and if you've got authorizations or any other information that the biller is going to need to add to your claim. So
yeah, absolutely. Now, I think we do have some questions, Jasmine. I don't know if you want to answer.
Yes,
those.
Thank you. I've got all these screens hidden over here. Okay, so let's see. Lee, I see there's always, let's click on this. Yeah, there we go. There's always the basics, the standards for, there really are. There's enough consistency in the basic solutions that are being created, I would just urge you to get in there and pick them apart using,
Yeah.
your expertise and, all of the knowledge in streamlined processes that you've learned. And this is the reason for this platform is we're going to continue driving all that home just based on our experience, knowing the things that we can't stand about certain solutions and processes and workflow issues. Both Rene and I are a bit of nerds about process. So yeah, we absolutely will drill it. So is OPM pre-coded for all specialties, or do you have to enter them yourself or request them to add the code specific for the specialty? So OPM has all of the codes available, and you can tell them yes or no if you want them to preload the entire database. And or you can create I forget what they call it. It's something like a favorites list or something. So let's say you work with these 3 specialties. You can have them create the list of favorites that automatically show up in your favorites list, so that you don't have to kind of be drowning in the full database if you don't want to see all of the codes. And they won't upload the codes if you don't want them there at all. If you want to just add them in manually, I don't suggest doing that. I don't suggest doing that, especially for the diagnoses codes, because there's just so many of them.
Right.
It depends on your specialty, right? If you're like in mental health, you probably have less than a handful that you're using on a regular basis. Who cares if you put it in and put your own custom code in there? Like custom, when I say custom code, I mean like the customizing the name internally. You can do that. You can customize the name of your procedure code. So let me open up this and see.
Sure.
Yeah, of course. I'm gonna have to reach out to them and let them know they've got to clean up my demo site here. So,
and the nice thing too about these billing platforms, a lot of times when prior to submitting the claims, it's basically going to run an audit, and if there's certain CPT codes that just doesn't go well together, or like for example, I have a client and she does only telehealth. She's a psychiatrist, and with Blue Cross Blue Shield, they are not reimbursing the 99205, 99215, or the 99417, which is usually billed with the 99205 or 215. And because it's telehealth, right? And so the billing platform catch on that, and like, hey, due to whether exclusions or billing guidelines per payer, CPT codes and such, cannot be billed for telehealth services. So, it goes to that level of detail, which is pretty cool because it really makes my job easier, honestly.
Yeah, absolutely. You want it to be able to catch on to the trends and try to make recommendations for you. Yeah, something that's a bit more intelligent. Yes. Lee asked this really great question about volume for gastro, 400 claims a month. So I absolutely am going to say yes. You can totally do a practice like that.
I agree.
Your number one is going to be to try to get it as streamlined as possible, meaning you want to use the integrations that you can, meaning like the software should have a clearinghouse built in if possible. You absolutely want to try to have a somewhat of an auto postable type feature. So like in the software, it will, as I said earlier, it has the ability to pull out denials, right? And even though, let's see, I'll go to the ones that are already posted. If there's data, hopefully. Yeah. So on here, for example, you can let it automatically post the claims, post the ERAs to the claims that are in the software. And as long as it matches properly to the patient's visits and there's no issues, it's not going to flag you. You have the ability to go in and see it and review, which our team has to review every single EOB that comes in or ERA that comes in. And we actually have another external system because I don't I'm a little bit of I'm still a paper hoarder, but I do it electronically, I guess is what I don't trust anybody. So I keep copies of everything. And so someone actually put that, hopefully you're watching live, maybe you'll get a kick out of this. Someone got to put a question on comment on one of our videos yesterday, saying that she's in an office that's like a paper hoarder where they print everything and save it. I don't print everything, but we do save everything, partly because, it's the responsibility of the providers to maintain a record. If we need to part ways, I like to provide full comprehensive records of all their payment batches, whether it's ERA or paper. And we store those according to deposit date, kind of like old school you would if you had a file cabinet that had the dates. It's the same way, but we do it electronically. And whether it's ERA or not, and our team has to review the ERAs when they come in, just to make sure that it's clean and clear. It doesn't take too long, and depending on the size. But what I was getting at for you, Lee, is that if you let the software auto post and you have things going automatically, so claims that are being scrubbed by your clearinghouse going out daily, you making sure that you're checking rejections, all that stuff, you're talking really like 5 or 10% of that 400 that might need your intervention, right? Yeah. So it's a fairly minimal amount of manual effort, as long as you keep your process very, very clean and you're super consistent. Like this job, revenue cycle, is not the kind of job that you can like skip a lot of days in order to make your life easier. And I say I mean, it could be your team, right? You could have a 3-day work week if you want, but you got to have a team working daily, because that stuff is coming daily, right? Your claims got to go out daily, and you need to make sure you're checking rejections and denials daily. You need to make sure that you are looking at the ERAs as they come in, the payments, if they're coming in manually, getting posted daily. So all of those things really have to happen on a daily basis. And so I urge you to create the process that works on a consistent basis first. And then for sure, 400 easy. I mean, like, depending on the specialty itself, you probably could take more than a handful of clients at that size. So, and depending on your efficiency, right? So, Rene.
Oh, awesome. Man, Jasmine, you you are so good. You know that? Jasmine, again, I'm speechless because Jasmine done took all the words out of my mouth. I'm joking. No, but awesome.
I do talk a lot, Rene. I know I talk. I know I talk a lot. I know it.
No, you're all good. You're all good.
A woman of many words. I hope it was helpful.
It was, honestly. I can't even add any more value than that. But I think Patrick has a question as well.
Did I skip? Let me see. I see she's coming with their cards. Yeah. I mean, there are so many companies, Ashley, that I'm like, seriously, y'all. Like, who is it with the Cigna for so many years with their use always with too much spaces, and then the two numbers at the end, the 0, 1, 0, 2, almost always getting skipped because there was too much of a space between the numbers and the 0, 1 or 0, 0 for the beneficiary. So let's see, is there an AMA fee for the codes? So they don't the software company doesn't charge, when you say AMA fee, maybe, okay, wait, maybe clarify what you mean for sure. But what I'm thinking is saying, do we have to pay for those codes to be uploaded? And I think so. You don't have to. Or if you're saying, is there an actual fee already uploaded, meaning one that's based off of the UCR for like Medicare or something like that, right? So you can, if you're talking about that. So first of all, they do not charge us to add the codes at all to the software, if that's the question. And the other part of it is, if you're talking about if it comes preloaded with fees, you can actually tell this software company, not all of them are the same, but you can tell this software company that you want it to be a certain percentage of Medicare, which is typically the way we set our rates. So if you know your practice is going to be 250% of Medicare or whatever, then you just tell them that, and they do an automatic calculation of the fee, unless the practice already has a certain rounded pricing. So like that happens sometimes in practices that have been around for a long time. No one really knew what they were doing when they set the fees. And so they just like, round it up, round it down, whatever. And so, you would need to just confirm with the practice that they're good with you resetting their fees, meaning like, hey, you guys before were at like 150%, and sometimes your insurance company was underpaying you because they would have reimbursed it higher, but you were only billing $200 for a procedure code when you could have been paid $250, right? And so you can make those recommendations to increase and then make it easy and consistent where you say, we're just doing an across the board percentage of Medicare that puts them above the minimum reimbursable procedure code for their specialty. So, and I could talk about that till I'm blue in the face. Fees are my thing. So we're not going to go too much further in that one, I think. Hopefully I answered the question though, Patrick. Let me see, taking this opportunity. I've been missing these overdoses. I know, Lee, you got to ask your question, girl. Lee is getting after it. Lee is always getting after it. We haven't seen her in a minute. So we got a few OGs that we got to bring back here from a few months ago. So we're glad you're back, Lee. So yes, let's see.
Yes. I did see where Patrick was asking me as far as the business rules. I'm if I have to create those. So yes, a part of it I can create it with the billing platform that I am using.
See that question. Oh, I'm sorry.
Oh, it's
okay.
No,
I'm
it's
sorry.
right after.
You.
It's right after the AMA one, and so pretty much yes. With the business rules, I can actually create it within the billing platform I use, or ability, I can basically call their support line if I don't have the time to do it, and basically just let them know, hey, this is the common issue that I'm experiencing, and this is what needs to happen. And once you explain to them what needs to happen, then basically they will they will work their part on the back end for you. And so that way, when those claims are being imported into your billing system, you shouldn't have that issue any longer. So that's the beauty of it. And honestly, you can create as much business rules as you want just to really make things that much easier for you. So that way you're not having to fix those things later on. So, yeah.
Yeah, so such good points. And I would tell you guys the same thing too about other clearinghouse features as well on your claim submission side. Let's say you have to upload to a clearinghouse. A lot of the clearinghouses have those scrubbing levels of scrubbing that they can add in that are user customized. And so if you, let's say you have an okay scrubber in your software, but you know that there's these codes that, unfortunately, your providers or your staff, they let loose and you can't prevent it. You can actually have your clearinghouse trained to catch those and block them, basically to push them back as clearinghouse rejections. So those are rules that if you're having issues with the software performing well and capturing things in the scrubbing, then you absolutely can have your clearinghouse kind of be, I would call it like a third level check, because you really should be doing a bit of a manual review of, or having, your providers do a manual review of their encounters at the closing of the day. And then you should have a process for scrubbing in your software. And then the third level is going to be that clearinghouse scrubber as well, whether it's integrated or outside of your software.
Right. Absolutely.
Yes, I am very detailed. I like how you say that. You almost say it like it's a good thing. You can tell my husband, he doesn't really call it detailed, my husband.
Oh, goodness.
He appreciates it though. But yes, I am a woman of many words. For the CPT codes. Okay, cool. So AMA charges for CPT. Oh, so they might charge for CPT, but it goes to the software company. We don't have to pay for it, which is a good thing for the database itself. Hopefully that answers the question there. But yeah, we don't actually have to. We don't have to pay for any of the setup fees, like related to kind of system setup, beyond just a basic. I think that the original registry we've had the system for a while, so I don't remember, but there was like an original setup. And then when we bring on clients, the one reason why I like solutions like this that are built more for billing companies is they're fairly minimal impact when you're onboarding clients. So you might pay like a nominal fee to get them, onboarded, the practice or the tax ID onboarded, not by provider. Because there's a lot of solutions out there that will bill you now per provider, and that can get costly when you have practices that have, a lot of providers and multi-level providers. So you don't want to get stuck paying, holding the bag for the per provider as you continue to grow where it's possible. Certainly if there is an all-in-one solution that is per provider, and you are only working with solo providers, then, it would probably be, not helpful. So bye, Patrick. See, you got a boogie. We actually got to wrap up here too, because it's getting late on our side of town, or my side of town. Renee's in a different time zone. So let's see about the fee schedule.
Central Standard Time.
Yes. You're a little ahead of the game. I'm still, it's almost 9:00 here on the East Coast. So let's see. Fee schedules present. Yeah. The fee schedules in the system can be very helpful with preloaded without you having to do that manual intervention. So does OPM do institutional billing processing? They can, yes. And I don't know enough about it because I don't think we've billed anyone, and I could be wrong, institutional from this system, but they do have the ability to do both UB and I guess it's not UB, but CMS 1850 or whatever. We're gonna call it the UB, but they have the ability, yes, to do both. So yeah, good question. What is our favorite clearinghouse? Oh, I feel like I don't know if I can say that publicly, a tribe. I don't know. I have a lot of relationships with. No, I can tell you. I can tell you who my favorite is. Go ahead, Rene. Who's yours?
Honestly, I don't know. I mean, I think working with different providers, who use Change Healthcare, Optum. For me, I'm using Ability, which is a clearinghouse. So I mean, I guess I would say Ability since I'm using them. I just, I like how quickly things seems to go as well. But I would say maybe the same thing about maybe Change Healthcare as well. But honestly, I don't really have a preference, I guess. That's what I'm trying to say.
So it's mine is, and I come from quite a few years of a lot of clearinghouse experience. So those of you who don't know, I've been doing this for like 20.
Oh yeah.
25 years or something like that. I think 25.
You are a veteran.
I have seen the rise of the clearinghouses, and I've gotten to see pretty much every single one that has been around long enough and is strong enough. And the truth is that the ones that can do the stuff we've talked about, like adding in the additional rules, like being able to customize according to your client. So let's say you say yes to a client software that doesn't have the ability to integrate. Can you do something like Rene does, which is what he mentioned earlier, where he's exporting a text file, which is like an old school, what we call print image file? Like, can you do a text file and send it to a clearinghouse? So different kind of flexibility is important. And then like ease of information like that, like some of the old school clearinghouses, y'all young bucks out there, just kidding. Y'all don't know nothing about those old school reports that we sent. It'd be like 50 pages, like from every insurance company. Oh, they sent like the clearinghouse acceptance reports, and like the only way you're like flipping through these reports, like to see that they actually got your claim. Hot mess. I've seen some clearinghouses out there that they still send reports in that way, where there isn't when there's a rejection, whether payer or clearinghouse, you can't really understand the rejection reason clearly, so someone can take action. So really, easily interpreted information, and then being able to ideally be able to just correct an issue in your clearinghouse quickly and easily. Now, certainly you're going to want to go out into your software, fix the issue really remedy the issue or resolve the issue 100% at the root. But if you want the claim to get out the door right then, you're looking at it and all you need to do is, fix one issue with a modifier or something like that. You can click that button, hit save, submit the claim. Makes it so much easier than having to do any other workflow, especially if you're separate from your software. So yeah, those are things that matter. So I say all of that to say my favorite right now still is Trizetto, which is Gateway. They've got bought out. They are owned by Cognizant or something now. But the product is at its core, at its roots, still one of the greatest. They also have the parent-child relationship for you. So if you have you exporting claims or you've got integration, but you want to see all of your clients in their solution, their ERAs are beautiful. Like they look very easy to read. They capture the denials for you. So there's a lot of little things that I like about them. Waystar is probably second on that list. I've had issues or have heard many nightmarish issues about people trying to leave that solution. So that's my only little bone to pick with them on it. And I've heard that they've changed it a little bit, I think post-COVID, because they used to have a 5-year agreement and you got to wait 18 months for the agreement to, if you want to do something, the whole thing. I don't remember. It was a lot. It was a lot. Yeah, it was a lot. So thankfully I never signed one of those, but I feel everyone's pain that did, and then had to kind of wait if they weren't happy with the solution or if they were, God forbid, closing their practice or whatever. So, so Trizetto is Trizetto. Trizetto. I'll put it into the comments in the video when you guys rewatch this. And we've been doing a timestamp on this. So if you just logged in recently, at towards the end of this video, we'll do some timestamps on the videos. We did this on the last video, and I think it worked out nicely for you guys that, that can't stick around the whole time, but you want to rewatch this video. So you can revisit any of our lives and find timestamps. We're going to try to go back and update the older ones as well, just so that you have just a quick, kind of reference of any questions that we may have gone over in the past. Yep, Trizetto. Yep, you got it. Trizetto, Lee. Yep. So Trizetto does charge, does have billing service favorable pricing as well. I think if you're looking at claims volume and things like that. So yes, trying to fix exclusions are a little much with some. Yeah, a tribe for sure. It is sometimes the clearinghouse can be the biggest pain point in any relationship.
Oh yeah,
you're bound to one. Not getting visibility, and now you're on the phone with insurance because you don't understand what your clearinghouse spit back at you. So, yeah. Well, listen, you guys, we really appreciate you being here, and we are going to be back next Thursday. I'm going to probably say, you guys let me know what your thoughts were on this topic. We went over this topic because we've gotten a lot of requests about billing software, billing solutions, and I just thought it was really helpful. We had gone over in the past some of our must-haves on billing solutions, but we didn't get a chance to kind of really give it life. So I hope that you found it helpful, but I want to know whether or not you guys did. So for sure, you can tell us in the comments now. And if you guys have votes for other topics or things that you want us to review, I like the screen sharing. We've never done that on live stream. So yeah, and a part 2. We have to do a part 2. We didn't get to all of our things, so we probably will do a part 2. We might pause.
Part 2 coming.
Part 2. We'll pause and do something else. If you guys have a vote for another topic, post it in the comments. And I was going to plug the Facebook group. Join the Facebook group if you haven't done that already. It will be in the description of the video. And if you are watching this on the replay, make sure you #replay and ask your questions here and or in the Facebook group. And yeah, do you have anything else you want to add there, Rene, Mr. Lumain?
All I want to say is thank you for everyone who was able to join. And for those of you that will be able to watch this later on, I hope you definitely found value in this. And, again, like Jasmine said, we are here to provide insight, to provide our perspective, and to really educate, so that way it'll help you to kind of grow your business or just to be a better biller. So I'm definitely excited and looking forward to doing this again as always.
Yes, thank you guys. Iris, I see your question about ClaimMD. I'm going to just quickly answer that. So I have, it has been a lot of years since I've been in ClaimMD. So I don't recall if I've seen it in recent years. So I'm going to do a little bit of research, talk to some colleagues and see what I think about it. And if you're in the Facebook group, I'd love to do an update post for you in there, just to give you my real live insight into what I like or don't like about it, or what my colleagues like or don't like if they're on it. So we all know the dirt, all us billers and that are OGs, been in the game for a minute. We know all the dirt on the software. Cool. I will look into it, Iris. So thanks for the question. Have a great evening, everybody, and we'll see you guys next week. Take care.
All right. Take care, y'all.